Medicare Advantage programs, Medicare Part C, those are in fact private insurance companies that have been subcontracted, if you will, by the federal government. So to get a Medicare Advantage plan, you will be purchasing it not directly from the government, but from a salesman. And there is an abundance of salesmen for Medicare Advantage plans. The structure of the legislation allows for these programs to be very different from original Medicare. Things like deductibles. How much money am I going to have to be out of pocket before the insurance kicks in, if you will. All right. Copays. If I seek a particular form of medical care, whether it be at a doctor's office or an urgent care center or an emergency room, am I going to be required to pay a certain percentage, or do I have a flat dollar amount that I'll pay?